Nursing 321, Restraining from the Use of Restraints by Regina, Caitlin, Brianna, Chelsea, and Danielle. What are restraints? So a restraint is any device that is attached to someone's body and can't easily be removed. The device is intended to prevent the person from freely moving or changing positions. There are many types of restraints. Usually the wrist restraints or hand mittens come to mind, but a restraint is anything that prevents movement. So things like the bed rail or bed sheets can be considered restraints. It's very important to monitor for any adverse effects associated to restraining your patient. This is why we closely monitor those patients. So some adverse effects could be increased restlessness and agitation, can cause your patient to become depressed, and then some physical effects like incontinence, impaired mobility, and pressure ulcers. All of this can lead to increased length of hospital stays. So the reason that any patient is being restrained is because they're doing something to put their safety at risk. Usually they're confused, agitated, they're getting up, you're afraid they're going to fall. Or again, that they're confused and agitated, restless, and they're pulling at those lines and tubes. So they're pulling out the IV, they're pulling out the NG tube, ET tube, pulling out that Foley. So all of this is a reason that someone might restrain their patient to cause them from doing any harm to themselves. Restraint alternatives. So it's always important to look at restraining a patient as the last resort. Some things you can do is frequently round on your patients, use a patient sitter or safety attendant if it's available, so have someone with them at all times. Disguise equipment, so kind of hide the equipment, disguise it so it doesn't look as scary, so it's not right in the patient's face. Treat the original cause of delirium. So find out the reason that they're restless and agitated to begin with and try to treat that cause. Remove or alter treatment. So as soon as those feeding tubes, IVs, Foleys can come out, to get rid of them as soon as possible. And distraction techniques. So music, crafts, books, anything that keeps the patient's mind off of what's making them restless and just focus on something else. Education to reduce restraints. So it's very important that every unit educates their staff on when to use restraints, when it's appropriate, how to properly use them, using them as the last resort, so all are alternatives to restraining your patient, and what to look out for as far as adverse effects. Every unit should have a plan on how to deal with difficult patients, and you should always work together as a team to handle those situations. Some interesting facts we found for you guys. Over 27,000 patients are restrained daily in hospitals in the United States. That's an average of more than 5 patients per hospital every day. We also found that the amount of deaths related to restraints are very underreported. According to the Medicare guidelines, restraints should be used only to guarantee the safety of the patient and the safety of the staff. Restraints should be taken off as soon as possible. And a study in the Journal of the American Medical Association says that restraints can increase delirium while used in the hospital by 4 times. And our elderly patients are already at a high risk for experiencing this delirium to begin with. That's why it's just very important to make sure that you know why you're using restraints, how to properly use them, using them as the last resort, so looking for any alternatives to restraining your patients, and what to look out for as far as any adverse effects. So hopefully all of this can reduce the use of restraints. Thanks, guys.